So did everybody, is anybody here? Got it. So I'm going to a third party somewhere. What does that mean?
Just as a reminder, we have,
Okay. I just got this big warning. This meeting
yeah,
is
just as a
going to-
reminder, we have to stream live to YouTube. So that might be what you got.
Okay.
Just as a reminder, we have.
Getting some crosstalk. Where was I? Okay, welcome everybody. Need to approve the January 19th meeting minutes. Very good set of minutes, very active meeting in the last month. Everybody read the minutes? Anybody want to approve them?
Motion to
I
approve.
can't remember if I was there.
I can move to approve the minutes.
Okay, thanks, Jill. Second?
I'll second.
Okay, that works. That works. I have no announcements. Does anybody out there have any announcements? Jessica?
Yeah, I saw on the TV the other night that there is a health fair, I believe, happening in March at the convention center. I don't know what that hotel is called over there by
River House?
Macy's. Excuse me?
The River House?
Yes, and that's about all I know about it, but maybe we can start to gather those types of events where we might be able to participate. I think it was more focused on physical health, but mental health is definitely part of a good physical health. So we'll throw that out there and we can wrap around back to that if we want to, or.
Okay,
Just in line with that, there's a Balanced Bend festival coming up again that the crisis team has been asked to participate in. And so Adam brought it to me and I said I'd bring it to you guys because we may want to, again, make it not just a crisis booth, but a Deschutes County Behavioral Health booth and have BHAB members help participate, much like last year.
Yes,
That's
and
an
I'd like
interest.
to say that we got 2 interested board members and 1 actual board member out of our participation. So, and the woman who did it, that was her 2nd year and it had already doubled. And she was very happy about that and thinking that it would do well in future. So that can be, so we can wrap around back on some of that calendar stuff. I need to let my dog out. He smells food.
Yeah, Savannah DeLuca is the person who has developed that festival, and she actually used to work as a contractor for the crisis program. So I think that's the connection with the crisis team and getting them at that festival. But it's growing rapidly, and she's done a great job with it. So
And
I think it's
really
worthwhile.
fun. Yeah, so it was fun. So that's 2 activities we can possibly do. And so we'll follow up on that.
okay.
I'm happy to look into the health fair at the River House and just get some information and send a note out to everybody and find out what it is and when it is and what the cost is and all that good stuff.
Thank you, Julie. That's wonderful.
Yeah, I'll take care of that.
I
Anybody
have
else?
I'm not sure if this is the time to mention it. We had somebody from Ideal Option come talk to our school, and we also had a drug team dog come to our school just to raise awareness. It was great community outreach. I know we used to have an RPA student on this committee who would attend, and I was wondering if that's something that we're interested in continuing with. I'm at Cascades Academy, which is an independent school, but we may have a student who would be interested in coming to the board meetings. And is that a good option? Is that still open for?
Yeah, I would like to have that person at that age group represented. I mean, it was really great when, I think her name was Kate.
So Holly, is there a way to perhaps offer some kind of credit, school credits?
Ooh, that's an interesting idea. I mean, we could certainly explore it. I think there's also, and I mean, whether Jill has somebody that would be great for it, or whether we want to open it up, there's our groups, there are youth advisory groups that we are very much a part of that we could also open it up to if we wanted to get a broader pool. But if we've also like Jill, just want to go with Jill's person too, I think that's a great option. But there are lots of avenues to try to get the youth voice represented that Shannon Brister would know all about and could help guide us. And then certainly we can look to see whether there's an opportunity to get some type of credit or something for their participation.
Another idea might be OSU Cascades, I guess, has a whole behavioral health department. And when I was trying to get sponsors for the NAMI walk last year, I tried to get into the right people at OSU Cascades, and I couldn't get the right person. And when I finally did, too much time had gone by and we were too close and they couldn't commit. But I think they have several professionals who have a little bit of a department there. And I think they have a psychology degree there. And so maybe an internship or something with somebody at OSU Cascades in the psychology program, it's just something that looks good on their resume, and they can participate and go back and share the word back at OSU Cascades, because that's our biggest college. And that's a huge group of young adults that I think could benefit from. I know they also have a health fair on their campus. That would be something we would want to probably participate in as well.
We have staff, some supervisors that are faculty do some, and so I'd be happy to reach out to them to see if they have contacts to to get ahead of that this year and connect you if that would be helpful.
That'd be great. Yeah.
Okay.
Thank you.
So Dana, maybe we could put recruiting of youth on our parking lot or our things to do, so we don't lose that. Good idea.
I got it.
Thank you.
Mhm.
Anybody else got any announcements or public comments that we need to get from the general public? If not, we'll see what Holly's director's report sounds like.
Yeah, hi everybody. Couple updates. I just did one for the behavioral health manager supervisor meeting yesterday, so I've got some stuff fresh on my mind. Obviously we are knee deep in all things budget. So that is a process that I feel like we're in all the time, but there's a brief moment in time when it stops and then it just starts again. So, like every county department, I think health services is certainly facing some big lifts this year. And personnel costs have just gone up, health benefits have gone up, just cost of living increases through our union contracts. I mean, all these things add up, especially when you're one of the larger departments. And so they add up pretty good. So we are in the process of really looking at everything, every way to save money, every way to advocate for money, every way to, create efficiencies within our department. And so we're actively working through that process, and we're making some real headway. There's a lot happening in the legislature around possible funding that could come our way in behavioral health, though it's a short session, and I feel like you don't really know what's going to happen with the short session because it's so fast and furious and things change rapidly. But as of right now, we are basically looking at a lot of things around Measure 110 that it could potentially be tied to funding for behavioral health. So we'll see how that all plays out. But there's we have the Stabilization Center as a potential project for them to consider helping fund the gap that exists with that funding. We'll see if that comes to fruition. We have a potential funding that could come if they decide to recriminalize small amounts of, or a portion of drug possession. There are some dollars that are looking to come to CMHPs as a result of that to help create what they're calling a deflection program, which is basically offering people an opportunity to engage in treatment and have their charges dropped. And it just kind of creating that incentive that it was missing from the original Measure 110 proposals. So that's kind of in the wings. We'll be looking closely at that. Kara Cronin, her program through our aid and assist numbers. So these are individuals who have been charged with crimes that cannot participate in their own defense and end up in what we call the aid and assist process. Those numbers have skyrocketed over the years, but Deschutes County behavioral health has done a phenomenal job in managing this without a lot of resources, to be honest. And we have some of the better numbers in the state and have been selected as one of 6 counties, I think, that will receive $1 million to help create a pilot program. It's actually not that different than what we were already doing. So it's kind of an easy win for us. It'll also help cover some existing costs, which is really helpful. And so that's a program that I think at some point, if the board's really interested in hearing kind of more about that, I'm sure Kara's team would be happy to come and talk about that because it's really fascinating. And there have been some law changes that have happened in the last couple of years that have had an enormous impact on the workload and what's happening with people unable to kind of get the level of care that they need and having lots of downstream effects as a result of that. So happy to talk about that. The other big piece of legislation that's kind of that AOCMHP, which is the Association of Oregon Community Mental Health Programs, has been actively involved in is around costing out services. So I think I've talked to this group a little bit about this before, that our agreement with the state and how we're funded essentially in large part has never really had any sort of rhyme or reason to it, to be honest. They sort of allocate dollars and they give some counties this amount and some counties this amount. And it's just all been sort of morphed over the years and doesn't really make a lot of sense. And it certainly doesn't cover the cost of doing the mandated work. So we have pushed to ask the state to please actually cost out what it takes to do this work that is required in our contracts. Not to say we'll get that money necessarily, but at least we know what it costs. And then we can start to advocate at the legislature for the proper amount of funding that it takes to do the work that's expected of us. So that's a bill that's, I think, moving forward. It's that I haven't seen any major opposition to it. I think there's been some pushback from OHA a little bit in terms of how long they have to do it. But we're pushing hard on that one and hope to see that one play out. Any questions on budget or legislation before I move on to one other topic? Okay. Just a couple of projects that we're in the middle of working on. And I think our community knows this as well as we do, of that we really need more residential capacity on all fronts in our community. A child psychiatric facility is something I think everybody agrees we need in our community, and we are still in active conversations with an organization called Jackson House, who has the resources available to build it. We need the land to put it on. The hospital is in negotiations with them around looking at what land might be available potentially. And we are meeting with the state in a couple of weeks to kind of continue our conversations to see if there's any state funding that can go towards the project as well. So it's got momentum. It's a process, but I feel hopeful at the moment about it. And there's still a lot of work to be done, but we're actively working on it and have city councilors in Redmond that are interested in this. Obviously, our commissioners are very interested, including the one, Commissioner Adair, who is here and who has actively been advocating for such a facility in our community for a while. So we are actively working on that. The other one is a secure residential treatment facility for adults that we are in desperate need of. We have one, as you probably know, in our community. That is not enough. It's been the same number of beds for as long as I can remember. Yeah, 11 years. So it's a need, and we're also working with this organization that for the child psych facility on this one. And we are real close. In fact, I should know in about 2 weeks whether or not the state is going to provide us. They were supposed to let me know today. I was hoping I'd have a really exciting update, but they said they need another 2 weeks, which is not a no. So that's good. And so we're asking for a couple $1 million from the state to go towards this project. And Jackson's House has already identified the land on which it can go, which is a huge feat for an SRTF. They often need special zoning things to go for where they can go. And then, and they also have the resources to build and operate it. So very close on that one. That's a critical need and will absolutely help the people we serve get the care that they need.
Is that another
Well,
16 bed facility?
16 bed.
16.
That's the rule right now. If that changes, I'm sure we would, be open to trying to get more.
Well, there's
Yeah.
been conversations around changing that rule.
There
that
has.
law many times, but Oregon's never applied for it like a lot of other states have.
Yeah, I think there's momentum on that.
Yes, Senator Wyden's office has been researching it. It's from 1963. It's 60 years old. I mean, now almost 61. It's ridiculous. It's so uncost effective. And, wouldn't it be lovely if we could build, 32 beds just for this side of the mountain so that parents would have a reasonable place to take their children when they really need that help and they don't need that frustration because they're not living a dream. They're living a nightmare. So Holly, keep pushing.
I will. So that's most of my updates. Let me make sure. I think that's kind of a high level summary of what I've been working on.
Thank you.
Thanks, Holly. Okay, moving right along. I had something on that in my presentation anyway. I wanted to, last month, Commissioner Adair mentioned that there's a legislative update meeting that they meet. I've gone back and watched a couple of them. I haven't watched any of them live, but I've gone back and watched a couple of the recent ones. And there's been lots of stuff going on. Those are pretty short and fast meetings. They're available, and just a little while I'll show you how to get to them. So
Yes,
we'll move on.
we had one this morning.
Did you?
I think there were like 17, 19 pages of our bill tracker. We honestly got through almost everything. I was shocked we didn't have any legislative reports, but yes, it was good. We have, I'm so happy to hear that Ideal Options was invited to a school. I think that's really, if more of our kids, it looks like more of our kids need to know the dangers of fentanyl and what's out there. So anyhow, we have them every Friday at 8 a.m. If you're up and you're interested, you can get on the Zoom.
Yeah, the one I watched was right after you were here at our last meeting anyway. So there were 3 of our state senators there. I think at least 2 or 3 representatives were there. So it was everybody's involved. Busy time for you guys. Okay, one thing that going through all my notes, trying to be a advocacy trainer. I'm not obviously a seasoned trainer or very good at PowerPoint, but we'll try. I learned some things. So why advocacy? Oh, there it is. Almost couldn't find my presenter view. Okay, there's a statement by Mason Zayad that people with disabilities are the largest minority in the world and the most underrepresented. I've looked at a lot of quotes trying to put together this program, but this one is really simple and to the point. I did not know the name of Mason Zayad, so I Googled it, and then I recognized her from a couple of things that I'd seen on the news a few years ago. I watched her TED Talk. She's an actress, comedian, author, and disabilities advocate. She lives with cerebral palsy. Like I said, she's a comedian. It's like one of my other favorite comedians, Josh Blue, also has cerebral palsy. But then she has many other credits too. She's a columnist and on-air contributor to the old Keith Olbermann show that used to be on. So, and actually, in her quote, it goes on to say that underrepresented in entertainment. I just left that part off because I think entertainment kind of says a lot about our society. We seem to be driven a lot by the entertainment industry. I mean, even our news broadcasters and commentators compete for Emmys, I think, more than they do Pulitzers. Another quote that I found for this thing is by Margaret Mead. I like especially the last part of that. Says it's indeed, this is really the only thing that has ever changed. Just about every U.S. Constitution amendment has started by the people. They don't start in the Congress. They start by a number of people getting together and, you know, advocating for change. So I think those of us in Oregon are probably more aware of some of this and most of the other states with our initiative process on how many ballot measures that we're faced with every election season and how many petitions during the year that we're asked to sign.
Roger,
Yes.
just a quick question. Are you meaning to share your presentation right now?
Oh, did I not do that?
Yeah, if you could hit share screen and then we can see your presentation.
Okay, that's right. I knew there was something else for you.
It's okay. There's a lot happening with Zoom meetings. I understand.
Okay, now I got to go back here. Share screen. That one. Okay. There, that's where I was. Now I can see. I couldn't see anybody. Wow, I wonder if there's anybody out there. Everybody went home.
That's perfect.
Okay. So there's the Mason's Iad quote that people with disabilities are the largest minority in the world and are the most underrepresented. And there's the Margaret Mead quote that never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. And if you look through history, that's pretty much a true statement. Next big question is why me? And another quote that I chased this one down because I knew it had been attributed to JFK, Winston Churchill, and others. Excuse me. But actually, I found out that it was first attributed back in the 1st century BCE. So it's been around a long time. If not you, who? And if not now, when? So the First Amendment guarantees our right to petition the government for redress of grievances. That's not only a right, but it's also a responsibility. So we're expected as part of the democracy to participate in our government the best we can, and advocacy is a big thing, the way we do that. Before we move on, I'm going to talk a little difference between personal advocacy and policy advocacy. When you advocate to influence the circumstances or services for yourself or someone you care about, then you're engaging in personal advocacy. When, you know, if I call Kara and ask her for some favors for my son who reports to one of her groups, that's personal advocacy. when you advocate to improve the circumstances for others, then you're engaging in policy advocacy. Policy advocacy is what we'll focus on. That's what our mission here in this board is. We'll just use our lived experience to help people living with behavioral health issues live in recovery, live the best life that they can. That's the kind of services that we want to provide. I think some of the principles are the same in no matter if you're personal or policy advocacy. You still need to be respectful and succinct and specific about what your wants are. So we'll use our collective experiences to inform policymakers and hopefully advocate for things that we want change. Paul.
Yeah, Roger, thank you. I just was going to make an observation that in my time listening to advocacy, sometimes it does start as personal advocacy, but I would argue that we can do both, or an advocate can do both at the same time. Sometimes that personal advocacy leads to to redirection of policy or reconsideration of policy. So I mean, I think a person shouldn't underestimate the power of engaging in personal advocacy actually leading to improvements in our system.
No, and that's a good point, Paul. And that's one of the things that I was when I was starting to put this all together, is that we all need to know that we're personal advocates to do this. And if we're not good personal advocates, we're not going to be very good policy advocates. So it's kind of it's hopefully the training that get everybody involved in doing their own advocacy. When they bring something to the board that they want us to look at, we can, they'll have a template and have some good idea of how to do that. But you're right, it all starts really with personal advocacy somewhere, and then you get more people to join your advocacy, and it becomes policy advocacy. I mentioned last month that we had like 8 people representing Deschutes County, and if you can see can you see my cursor when I do that? No. Okay. Well, if I turn on
Roger, isn't it 7? I thought we had 4 representatives and 3 senators. I don't know. Maybe they added one in the meantime, but I thought we had 7.
Let's see. Let's move to the next. There's 3 senators, 1, 2, 3, 4, 5 representatives. These are our senators. Tim Knoop represents Van Tumlo Sisters, north part of Redmond. Dennis Linchcomb, I think that's the way you say that.
Linthicum, yes.
Linthicum, yeah, has that extra syllable in there, doesn't it? Represents all of South County and actually east of Van Clair, including the Bend Airport and out to the Crook County line to Alfalfa. And then we'll get all these names and addresses on a single sheet of paper and include it with the minutes or someplace and get it out to you. Then Senator Lynn Finley represents Crook County and basically everything east, but he also has the southern part of Redmond as well as Terrebonne and the Lower Bridge area out the way.
He's actually my senator, and he lives over in Ontario
or Vail or somewhere
yes.
over there.
No, he's way over. He's on the Idaho border because I can call him at 7 a.m. and it's 8 o'clock where he is. So it works out really well.
Yeah. Yeah. And he does town halls on a regular basis, virtually. I get updates from Tim Knoop. I don't remember ever getting anything from Dennis Linchcomb. but I might not be on his mailing list. I'm not sure. And I think Senator Finley is not going to seek re-election. Is that right? You know that?
That's correct. Yes, Mike McLean from Crook County is running for his seat that I know of.
Okay.
I'm not sure who else.
Okay, and there's the representatives. Emerson Levy represents the north part of Redmond, on out to Sisters and that area. Jason Croft basically has just the city of Bend. I don't know if that's exactly along city limits or if there's any extenuating areas or not. And Werner Reske has pretty much the same area as the senator, east of Bend and all of Deschutes River Woods and all of South County. And Vicki Breezen Iverson, Crook County, has all of Crook County, and then she's got that north end of North Redmond, Terrebonne, and Lower Bridge, their area, and Crook River Ranch, what part we have. And then here's the one you probably don't remember is Mark Owens, is our fifth one. He represents people in Brothers, Milliken, and Hampton, and those areas east of Horse Ridge. So there's not a lot of population out there. He very much like Senator Finley has a very large, I think he has the next two counties also, Lake and Malheur.
Oh, he's a hay rancher over in Crane. And he's
Okay.
actually the water expert that has been working with Representative Ken Helm, who grew up in Deschutes River Woods. So the two of them have done a lot of water management planning. They are making progress in the state. So yeah, it's great to have Mark. I didn't realize he had it in Deschutes County, but he does take my phone call. So that's nice. He is definitely the water expert.
Is he?
Yes.
But I know he's often included in the town hall meetings that Senator Finley does virtually, at least once a quarter, I think, that he does those. I haven't heard nearly as much from our representatives. I did make sure that I signed up for all of their newsletters, but I haven't heard anything coming out of the legislature yet from them. I don't. But that just could be just me. Anyway, that's one of the first things that you have to do in advocacy is figure out who you want to talk to, who needs to talk, who you need to talk to, identify the policymakers that are out there. And then we got our own Board of County Commissioners. This is a page from their webpage, this link right here with meetings and agendas and minutes, videos. You can go back and watch the county commission meetings. I usually do this instead of watching them live because there's lots of things that I'm not very interested in that they need to take care of. So I just watch for this and road department stuff. And you can go back, you can go into the agendas and see who's presenting, what topics are on their agenda, and scroll through fast forward through the meetings and hear what you want. And also, that's what I was mentioning a while ago, that these meetings that they've been having with the legislative updates are found on there too. And all these people are pretty good about answering their phones or returning calls, but don't be surprised if they do answer their phone. So if you decide to call them, don't plan on just leaving a voicemail. You might have to talk to somebody. What do we got? Okay, I did a quick look for the chat, see if somebody was chatting with me specifically, because I couldn't see before. Okay. So that's who we need to talk to. Here's things that we need to know to advocate, how we advocate. Oh, yeah. One of the first thing is to meet somewhere, have some kind of meeting. You know, the town halls, later this fall, summer and fall, we'll have some candidate forums. Those are always good places to try to meet. You know, when I started advocacy, I think I've mentioned before that I used to come to these BHAB meetings just to kind of be involved, try to educate myself, things that I needed to do. I used to look at the agendas for the Board of the County Commissioner meetings, and I would attend those when there was a behavioral health issue coming up, mostly to get, you know, my own education on what was going on. And that way I got to meet a lot of the staff members, both at the administrative staff downtown as well as health services staff. And, you know, I kind of had some advantage because I was already going to be at those meetings with my road department job anyway, so I could just kind of stay and watch and maybe learn some things from the other departments. Need to be educated, both ourselves and then before we can educate others of things. So you get your personal story together, you learn as much as you can. You got to be prepared when you're making a presentation to somebody and they ask questions. You have to have some preparation ahead of time so you know what questions that you might need to respond to. And one of the other things that I learned a long time ago is you don't use statistics that you don't understand. So if you can't explain what those statistics mean, putting them out there can be a trap for you that you fall into. And somebody asks a question, and I don't know what it means. It's these numbers, you know. So it's always good to know the best that you can. You don't need to know everything about what you're asking for. You just need to know your own personal involvement, how things affect you. But you do need to know what the facts are, and don't rely totally on emotional effects. Question everything. And that's what I did when I came to these meetings. Especially acronyms. It was always good to just ask, what, you know, raise your hand and ask, what does that acronym mean? And get it explained to you. It just seemed to be one of the places that this arena has a lot of acronyms that mean a lot of different things. I know, and somebody tells me this as well, this comes from the federal government. I understand that a little easier than when it comes from SAMHSA, because I don't necessarily know what SAMHSA is. And just ask people to explain things a little bit better. And chances are, one of the things that I've learned quite early also was, if you're listening to an expert and they say something you don't understand, it's a good chance that about at least 50% of the people in the room didn't understand it either. So somebody needs to ask the question, try to get a better answer, and you'll have people come up to you after and say, I'm glad you asked that question. And then, of course, the easiest way and most definite way to advocate is to vote for the things that you believe in, the things that you need to participate in, that you want things to go your way. the place to do it is to vote. Nobody else knows that, but you do. Okay, right? Just an email, a tweet, a letter, just some thank you for some simple notes. You don't have to get real flowery about this, but a simple note, maybe a question, just a good follow-up after a meeting or something to let people know that you appreciate that they were there and that they listened to your story. Now get your name recognized as an advocate, somebody that they'll remember. Phone call will do the same thing. Even if it is just a voicemail, say thank you, and you don't need to call back. Just wanted to thank you. Thanks. Please support this. Please support that. But do be prepared that somebody might answer the phone. Happens a lot nowadays that you get, expect to leave a voicemail and then somebody's there. And then posting things to social media, not really specific to policymakers, but to anybody else. If you just share who you are, what you believe in on your own page, you'll get people to know that you stand for those things. Your friends and friends of friends will know who you support. Like I said, I have the little green ribbon on my Facebook accounts, X account, those kind of things. And that same thing is just wear a ribbon, wear a green ribbon, wear stickers, pins, and supporting t-shirts so people know the things that you're involved in. I ended up with way too much time on. This next part, I was just gonna schedule for next time. Give some templates, some more discussion on, or some discussion anyway, on how to tell your own story, steps involved with that, the introductions, how you're affected by the issue. Not a saga, but just tell us the story of what happened and things that are important to you that make it your story. They will, follow through and understand that it has some kind of an impact to them. And we'll go into more of that. I do have some templates. I do have some worksheets that we can work on for those personal stories. And the next phase, whether we do it next month or the week after that, is some kind of a template that we can work on in this group to find out, identify a problem or complaint or an issue that we want to promote, and how we're going to do that to reach a consensus in this group, and that whether we write a letter, make a phone call, invite somebody to advocate to. Well, that'll be the third step in all of what we're going to get done to make us more of an advocacy group than just a show and tell group. And that's really the end of my presentation. Let's see, it's
Roger.
yeah. Paul, got your hand up?
No, I was applauding
Oh.
you. Thanks for doing
Oh,
that,
okay.
Roger. Well, I might, since you gave me attention, I'll just say I really appreciate you doing this presentation, because, I mean, again, I've seen all kind of advocacy happen in Oregon over the last 30 years that I've been doing this work. And, sometimes we as public officials or, as staff will try to advocate for a cause, and it kind of, it only goes so far. It kind of falls flat a little bit because we're paid professionals. But senators and representatives and others hearing the voice of the people who are receiving the service, that is really critical in terms of getting legislation to move and getting attention of legislators. So I really appreciate you doing this and empowering people to become better at advocacy. We certainly need it. And, we can do it in partnership. But yeah, it's really is critical. Thank you for doing that.
Well, thanks for saying that. I'm a pretty shy introvert. So to have all of a sudden getting this moniker that I'm an advocate was kind of a surprise to me. And, the one thing in my experience that once you start talking about experiences like mental health issues, you realize that you're really part of a very big club. I remember when my son was first diagnosed and all these terrible things were going on in my head, and I was at a conference up in Washington and sitting at the lunch table with people that I didn't know. I knew a couple of them. There's 6 or 7 of us, I think, at that lunch table, and somebody asked me a question, and I said, well, I've been working on trying to get my knowledge because I have a son with schizophrenia. And it's just amazing about that small of a group, how many people said, no kidding, me too. So, and that was 25 years ago. Just about 23 years ago anyway. So that gave me a lot of impetus, I guess, to bring it up in a lot of different situations. I remember one of the county commissioners back, several years ago when I was going to all these meetings, and there was, they weren't really road department issues, and I'd go to the mental health issues meetings, and he asked me why, and when I just had that was an opportunity to tell my story, and after that he was very supportive of everything I did. Jessica, got your hand up. You're on mute too.
Yeah. So thank you very much, Roger. I really appreciated the part about our senators and our representatives and the format of really how do you go about advocating. That was really good. I got a lot out of that, and it made my brain start thinking more about advocacy and the types of it. And I wanted to share with you, in Sacramento County, we had a big need for youth residential treatment, as we've talked about it here. And probation was on board, district attorney, public defender was on board, mental health was on board kind of at the time. And of course, alcohol and drug services were on board. And down there we had a board of supervisors. So the board, you have to take youth proposals to the board of supervisors to get permission to go forward. And you know who was really organized? NIMBY, the neighborhood where we wanted this. So every person knew that there was a need for this service, but that neighborhood was so organized, it fell apart. It like dead on arrival. And they were really organized, where all of us, we were for it, but we weren't organized. And we didn't have the community members at that meeting that could help support that advocacy for that proposal. They still don't have a youth residential treatment down in Sacramento. And that, I mean, that was probably 10, 11 years ago that happened. So that came back to my memory when you were talking about being organized and having a message, and the power of numbers and the power of community members, that neighborhood had a right to advocate too. And they did. So I just really want to thank you for that, and kind of gives us a good baseline of which to move forward as a board.
That's very important when, we faced a lot of the same things when Telecare opened the residential treatment homes. They're not even secure homes, especially a lot less when they opened this secure facility because of location out by the jail and all that. It was not nearly as controversial as the residential homes that they put into a couple of neighborhoods. Fortunately, Telecare had been doing this all over the country. They're very organized, very well, had really good arguments, and basically because they were homes, their homes were already built. There were only 5 beds, I think, for each or something. There wasn't any reason that anybody could buy those houses and put whoever they want. So they had made a good arguments that way, and it really showed all the support that they've had around the country. They were very organized. If it had fallen to those of us who were just promoting it, we wouldn't have got very far.
I just want to piggyback, if this is the right time, that Commissioner Dare linked me with Jen Patterson, I believe her name is, and I will be meeting with her next Thursday to learn about how to write letters of support and advocacy. And I realized as I was listening to Roger's presentation that I want to move from just having a casual meeting with her, which it's going to be casual anyway, but to have some specific questions and hopefully leave with some samples, even if they're didactic or whatnot. So if you have a specific question or area that you would like me to ask her, please put it in the chat or email me or email Dana, and she'll toss it my way and I'll make sure and ask that. There are some things that I'm thinking of, but I just realized that I want to maybe go in with some kind of framework so that our time is really enriched and I don't waste her time. And then I'll be able to bring that back to the board as well.
Okay. Any more comments, questions? So, Jessica, what do you have for community events besides what we've already brought up?
Yeah, I realized I did that in the announcements. I didn't forgot I was on there. So what do I want to say about that? We do have the calendar, and maybe Dana can refresh us on how to access that calendar. I don't know if we want to consider a small subcommittee that we can have for community events. I just want to bring that up because this is the beginning of the year, and last year we had a goal of attending 2 and we squeaked by, and we got that 2 in. But I think in our year ahead, I think we wanted to do a little bit more than that and get out and be seen. So that's really all I have on that. So a couple of things. Number 1, how do we put some on the calendar, and how do we get ahead of some of these events so that we can have a presence? Dana, is the calendar available or?
Yes, I can put the link in the chat, but I don't have it updated since we haven't really discussed.
Yeah, so that'll be forthcoming. So maybe we can work on that a little bit offline. And then the other piece that I wanted to bring up that I'm kind of not very articulate today, but what if I want to bring up? Well, that's it.
Are you talking about the subcommittee?
Oh, I know what I wanted to bring up, is I wanted to bring up the finalization of the year in review report, that it's out and ready. So, I think we did a really good job last year, and I think that report reflects it. And hopefully it will guide us to next year. And this is about 100% of what I have today, which is 50% of what I had yesterday. That's it for me.
Okay. So I guess we get to adjourn just a little bit early. I don't think anybody has a problem with that, do they? So look forward to seeing everybody in March. Hopefully we'll be
All right.
back together.
Oh,
In
yes,
person.
thank
We'll be back.
thank-
Oh, go ahead, Holly, sorry.
I was just gonna say thank you for accommodating this request. As you all know, we have space issues within health services and do our very best to try to meet in person. Stan Owen is a very popular room, and we've been fortunate to be able to reserve it for our needs most of the time, but there are occasions when we just can't do it. So appreciate everybody pivoting to Zoom, and yeah, and we'll be back in person next month.
Bye, everybody.
Bye, thank you.
Bye.